It's a pleasure to join you all virtually from the White House this morning. In my remarks about vaccine distribution for all, I'll cover two things. First, how governments and the private sector should work together to ensure vaccine access to all residents. And second, how leaders can leverage the lessons from the COVID-19 response to strengthen health systems and pandemic responses for the future. We all know these are critical topics. Vaccines are our most important tool to protecting ourselves and our loved ones from this pandemic and from future pandemics. They are enabling us to spend more time face to face, go back to school, eat safely at our favorite restaurants, and return to work with our colleagues. They're making our economies to keep moving, and they're allowing us to hug our loved ones without fear. We have to ensure vaccines are widely available. So I'll start there on vaccine access and on vaccine equity. This has been our priority from day one of the Biden-Harris administration. When we came into office, we set two objectives: get shots in arms as quickly as possible and do so as equitably as possible. And as a country, we leverage partnerships between the federal government, state, and local governments, the public health community, health systems to pursue these goals. We've provided billions of dollars in government funds to state and local governments so that they could stand up their own vaccination clinics. We've helped tens of thousands of local hospitals, doctors' offices, and health clinics to do the same with funding and technical assistance. We stood up high throughput mass vaccination clinics nationwide. We shipped vaccines directly to tens of thousands of pharmacy stores and to community health centers, which provide health care to our most underserved communities. Vaccinations were being administered incredibly quickly in the first 4 to 5 months, and the partnership between government and healthcare providers was driving remarkable results. By the end of May, almost 175 million people have received one shot. But even as we prioritize our initiatives to promote vaccine equity, racial and ethnic vaccine disparities persisted. So in those months leading up to and after May, our pandemic response transformed from an all-of-government response to more of an all-of-society response, which also activated businesses, community organization, faith-based organization, public health leaders, and inspiring figures. And we've doubled down on efforts to activate local doctors nationwide, communities and patients people know and trust. And let me give you some example. To improve access and make it even easier for everyone to get vaccinated, we made sure there was a vaccination site within 5 miles of 90% of people living in the US. We've deployed tens of thousands of pop-up vaccination sites at community and faith-based organizations, at schools, at business sites, sporting events, and barbershops. Uber and Lyft offered free rides to and from vaccination sites. Childcare was offered for free to watch kids while parents got their shot, which was important in low-income communities. And we asked businesses to offer paid time off for all individuals to get vaccinated. Second, we placed a huge premium on building confidence in the vaccine by launching a nationwide grassroots network of local voices and trusted community leaders to encourage people to get vaccinated. We rolled out public ad campaign about the vaccine and elevated trusted physicians and community leaders as vaccine ambassadors on local radio and TV. And we've deployed billions in funding to support local community efforts to educate about vaccines. And third, and most recently, we have encouraged and facilitated vaccine requirements for US government employees, for healthcare workers, and for companies with more than 100 employees. These vaccine requirements cover over 100 million workers in the US. And our definition of all society expands beyond our borders because we know this virus doesn't respect any boundaries. That's why we continue to support global efforts. We're proud to have donated nearly 150 million vaccines to over 90 countries, more than all other countries combined. And we've started to ship another 500 million with vaccines purchased to donate to 100 lower income countries in need of vaccine. So what did we learn to leverage the lessons here to strengthen our healthcare systems and our pandemic responses of the future? Our public health infrastructure has been overstretched. Our data systems for disease monitoring and sequences need to be improved. Historical health inequities in our country have been exacerbated in many ways, and we've already made significant investments to address these issues. Billions of dollars to hire and train public health workers. We're building genomic epidemiology infrastructure to prevent and respond to future biological threats, including supporting cutting-edge research into genomic epidemiology, and building a national bioinformatics infrastructure to create a unified system for sharing and analyzing sequence data to enable informed decision-making. And on top of this, we have, of course, made historic investments in enhancing and securing supply chain in vaccines, PPE, ventilators, testing, and pharmaceuticals. Importantly, we've put our money where our mouths are, and I think it is an important lesson for all of us on a global scale. We want to ensure positive health outcomes in the long term and not be flat-footed when the next pandemic comes, which it will. So I'll wrap with this. I believe we have the tools to end this pandemic. Now we just have to finish the job with truth, with science, with resources, with confidence, and most importantly, together as a global community. Thank you so much for having me here today.